Welcome to VNA Health Highlights, a program of the Visiting Nurse Association of Cape Cod. On today's program, we're going to learn a little bit more about the SHINE program and what that is. And we're lucky enough today to have as our guest Sheila Curtis, who is the Regional SHINE Program Manager for Cape Cod and the Islands. So thanks, Sheila, for being here today. I appreciate your time.
Well, thank you for having me, Jeanne.
This is always fun to get the information out to the people.
It really is.
So, and I always like to start with, what's your history and what got you interested in something like this? How long have you been on the Cape?
Okay, well, my husband and I, we moved to the Cape in the mid-90s. Didn't know anyone really, so I went out looking for a volunteer job. I started out at the Barnstable Senior Center, volunteering at their adult social day program.
Oh, nice.
And then they hired me part-time, so I needed another volunteer position. So I saw an ad in the To Your Good Health back in 2001 looking for a SHINE counselor. They were having a training. So I called, took the training, and became a SHINE counselor back in 2001. And then 2003, the director at that time called and asked me if I wanted her job because she was leaving. And
nice.
I'm like, oh gosh. I said, sure, I'll give it a try. And so I became the regional SHINE director in 2003. I left for personal reasons the end of 2009. I still did SHINE counseling.
Okay.
And then I just came back the end of last August as a regional SHINE manager.
Oh,
so I'm
excellent.
Glad to be there.
So you know it inside out. You've been doing it long enough.
Yeah. Things change every day, it seems.
Wow, yeah. Well, that's great to have that kind of history with it, though.
Yeah, I love it.
Have you seen changes within the program over that time, or has it pretty much stayed the same?
It's changed. It has changed over the years, definitely.
Yeah. And you started as a volunteer?
Yes.
Yeah. So I think there's a lot of people out there that are volunteering that one thing leads to another and they get tied into something bigger.
All my jobs on the Cape have been from volunteer jobs.
Oh, yeah.
That's amazing.
That's great. So tell the viewers what SHINE stands for.
Okay. Well, it used to stand for Serving the Health Information Needs of Elders. Oh. But we recently changed it last fall, actually. It now stands for Serving the Health Insurance Needs of Everyone on Medicare. Because what happened in 2006 when Medicare Part D came around.
That's the pharmaceutical piece of it.
The drug portion. That affected everyone on Medicare, not just people 65 and over. So we started seeing more under 65 who are on Medicare due to a disability.
Okay.
So that's why they changed it. We don't just see elders, we see anyone on Medicare.
It sounds a much more inclusive title, isn't it?
Yeah,
much better. Yeah. So what is the program exactly?
Well, we help Medicare beneficiaries try to get through the maze of Medicare. It can be very confusing. Things, like I said, constantly change. So pretty much we're there to try to help them navigate the health
system.
Yes,
yeah.
System, yep.
So you have people that you help that are already existing, people that are already on Medicare that have questions as things change or their lives change.
Right.
And then are you available to new people that have reached that point of now it's time?
Yeah, and that's the ones we're actually trying to reach. I'm actually doing a baby boomer welcome to Medicare party. In April 15th at the Mashpee Senior Center. We're trying to reach out to those people, maybe 62 and older, just so they are aware of what they need to do when they do turn 65.
That's a good idea.
Yeah, because people don't realize they have to take Medicare at 65, even though they're not collecting. So if they wait till they start collecting, they may have penalties. So they really need to look ahead just to make sure. Yeah. So
interesting. So who administers the program? Is it a town or state?
The state administers it, Executive Office of Elder Affairs.
Okay.
And we're funded through Medicare, Centers for Medicare and Medicaid Services. So they fund it.
So the feds fund it.
Yes. And
but it's managed at the state level?
The state level.
Or
yes, they administer the money to the different regions across the state.
Is that how it's broken out by region?
By regions, yes.
So is it Cape and Islands and then East Massachusetts
I have Cape and Islands,
or Central?
And Hesco Elder Services, she has different counties, so it's broken up into counties.
Certain counties belong to each group.
Yeah.
Seems like covering a lot of area.
I think there's 15
Oh, really?
across the state.
And it's just the state
Regional.
of Massachusetts.
Well, not really.
Okay.
Actually, Shine started out as a pilot program here in Massachusetts in
Aren't
the
we good at that?
1980s.
Yeah.
Yes. And now it's a federal, the federal name is called SHIP, but we kept Shine because that's what we had started
yeah.
out with. So it is now across the U.S. You can, any state, you can call your local SHIP counselor,
Oh, yeah.
and they might have a different name,
Yes.
but the national name is SHIP.
Oh, yeah. So what is that? Senior health
State health insurance program.
Oh, state health
Yeah.
insurance program.
Yeah.
Oh, yeah. So finance monies come from the federal government
Yes.
to the states. The states then distribute it to the 15 groups that they have within this state. All right. Is there a fee for people to come and talk to you, or is it a free?
No, this is a free
a
service.
freebie.
Free service, and we're here to try to help as much as we can. Can't always help everyone,
Right.
unfortunately, but
Yeah.
we try to help. If not, we maybe refer them to other agencies, such as the outreach workers at the senior centers
Oh, yeah.
or elder services, depending on what their circumstances
Yeah.
are.
Yeah, that's a big job. I'm just doing this in my mind thinking of our population, that you must have tons of customers here.
We do.
Do you?
We definitely do.
So you're the manager, and then you train counselors because you can't do it all yourself, certainly.
Right.
So you have counselors
I do.
that are on your team.
Right. On the Cape right now, I have 47, well, Cape and Islands, I have 47 Shine counselors. They're volunteers. They go through extensive training. It's 12 days of training.
Wow.
And I'm actually starting
Consecutive,
a new one.
like 12?
No,
No?
it's 2 days a week.
Okay.
Over 2 months, like.
Okay.
I'm actually starting a new one tomorrow. I have 13 new counselors that are going to be
Wow.
going through the training. So they have to go through the training. They have to take an exam to be certified. And then they have to attend monthly trainings for updates and be recertified every year. So it's not an easy volunteer job.
I was just going to say, for a volunteer position, that's good
it's
for
tough.
them.
It's a great job. I mean, you just feel so good when you can help someone.
I bet.
And I think that's what keeps the volunteers going. You know, just helping one person that one day is.
Oh, they probably
means
walk out,
everything.
give them a
Yeah.
big hug, and because it is very confusing.
Oh, it is.
Yeah.
It is. Even
So,
for us that
I know.
do it. I mean, because the changes, it's just
Yeah.
trying to keep up.
Even within the industry, it seems like there's something new that comes out all the time, and you have to implement that within the workplace. And
Exactly.
then the people that are out there using it have to learn it too. Yeah. So you have the islands too, you said.
I do.
So do you have a few people over there? Or?
Yeah, I have 4 volunteers over on the vineyard and 1 on Nantucket.
Wow.
So I've been kind of going over to the vineyard since I started August because I'm down a couple of counselors, but I'm going to be training another one this time, so hopefully I won't have to go over as often.
Right.
I mean, I enjoy going over. It's just, it takes me away from the office, so
Sure.
it's kind of tough, yeah.
What's your busiest area geographically?
Falmouth.
Oh, really?
And Barnstable, yeah.
Oh, yeah.
They're so busy, so busy. Yeah.
So do you have, then you can manage your volunteers or your counselors, so you have more counselors available in those areas,
Yes,
or
yeah.
that's where you recruit
Definitely,
from.
yep.
Yeah. Yeah. So so they do a 12-day
12 days,
spread out over a couple months,
yeah,
and then they get an annual tune-up.
an annual tune-up.
Okay,
And
are you-
monthly updates. They have to attend
Oh,
a
okay.
monthly meeting.
Oh, a monthly meeting.
Yep,
Just so they stay up on everything.
exactly.
How do they get their assignments? Is that
It's usually based on where they live. If I need a counselor, like say they live in Falmouth, and I
Yep.
need another counselor in Falmouth, that's where they'll go. The senior centers are the ones who set up the appointments for the volunteers.
Oh, okay.
Yeah, so they go a specific day, so many hours per day, that day.
Okay.
And the appointments are already set up for them.
Oh, okay.
So they would need, so if you wanted to go see a Shine counselor, you would need to call the senior center and make an appointment.
Okay. So if I'm thinking for the viewers, so they get to see both sides of it. So as someone in need, if they have questions, they can call you,
They can call me.
or they can,
Call
in
the
every
whole-
town, check with the senior center, and they'll have the answer of, oh yeah, the next Shine representative will be here on such and such a day.
Exactly.
Would you like to schedule a time?
Yep.
And then for the Shine counselor, they need to know that one day or however, what is it, one day a week or so? It must be different.
Some do one day.
Depending
some
on how
do two,
busy.
yeah.
Oh, yeah. But they commit to a full day of answering those questions?
Most of them are 4 or
10 to
5
2 or
hours a
something?
week.
Yeah.
During the open enrollment, they tend to help
that
out
would be a
more
big
because
time.
it's so busy during that period.
Yeah.
Yes.
Wow. That's how, I'm impressed by the volunteers. That sounds like a lot of work.
I am too. I love my volunteers.
Yeah.
Couldn't do it without them.
Yeah,
It's amazing.
wow.
Yep.
So they're not paid?
They're not paid.
Okay.
Nope.
And they counsel at the senior centers? Is that the only?
On the Cape, I do have a volunteer at the Community Health Center, also in Mashpee.
Okay.
Some of the other regions have volunteers at hospitals, the VA centers,
Oh, yeah.
libraries, but mainly on the Cape, it's the senior centers.
Isn't that nice?
Yeah, I'm trying to reach other areas,
Yeah.
but I haven't quite gotten
Yeah.
there yet.
Yes,
So,
yeah.
yeah.
Well, that's so convenient, and the senior centers do such a great job.
Yeah.
Yeah, that's good. Is there an age limit for counselors?
For counselors,
Yeah.
no age
No?
limit, and our clients can be any age also, as long as they're on
Oh.
Medicare.
Okay. Do you get people that come and look for guidance for a family member that maybe aren't on
definitely.
Medicare themselves, right?
Caregivers come all the time
Yep.
looking for help for their mom, dad, daughter, son.
Oh, yeah.
Yeah,
So you're open to anybody that's
exactly.
getting the right information.
Yep.
So if they come and they don't fit the counseling criteria, is there someplace else they can go to?
Sure. Like, we'll say they came to us, they weren't on Medicare. We would probably refer them to Community Action Committee, who deals with the under 65, the new insurance.
Oh, okay.
They've been trained. The community health centers, because they all have access to the virtual gateway, they can do all that online. And we're not trained in all this new under 65 insurance.
Oh, yeah,
so I wouldn't
yeah.
want to steer anyone wrong. I mean, I
Sure.
could probably help them
You can
go
field their
online
questions,
but
yeah.
I would want to send them to someone who
What was the virtual gateway that you just mentioned?
that's where you can enroll for all the
okay.
insurance
For all the
programs.
different- the new-
Yes, the new insurance programs,
Okay.
Mass Health.
Yeah.
Yeah. So those people I would send them to those people because they know more about these programs than us.
Okay.
But if they're on Medicare, hopefully we can help them.
Yeah.
Yeah.
So you and the counselors know all the ins and outs of Medicare.
We try.
You are
We
the
don't know-
Medicare experts.
We don't know everything. Believe me, I learn something new every day.
Because it changes. That's
Yeah.
just so
and it's
tricky.
just something that comes up that I hadn't encountered before,
Yeah.
an issue, and it's like, oh my gosh, something new.
Yeah,
Yeah.
yeah. So what kind of counseling, like talk about a counseling session, what kind of questions do you get?
Okay, so what we're really seeing a lot of now is people turning 65. So they'll come to us, we'll go over the whole gamut of Medicare. We explain what Medicare Part A is, what Medicare Part B is, what Part C is, Part D, the drug program. So we go over all that, what it costs, what the different Medigap or supplemental plans that are out there.
Like, what would that be?
Well,
I'm just thinking.
Blue Cross, I mean, not Blue Cross, but there's 2 Medigap plans available in Massachusetts. One's called Supplement Core,
Okay.
and one's called Supplement One.
Okay.
One is cheaper than the other, but it doesn't cover all the gaps, because Medicare doesn't pay 100% of everything.
Yeah.
There's a hospital deductible, your Medicare Part B deductible, and then you have to pay 20% of your doctor's bills after that. So the Medigaps fill in those gaps.
Okay.
So we go over what they cover, what they cost, and then we talk about Medicare Advantage plans. That's the Medicare HMOs and the
Like
PPOs.
Med-X?
No, Med-X was the Medigap.
Oh,
You're
okay.
good though, yeah. The
Okay, that's
Med-X
what
was a
I've heard,
Medigap,
yeah.
yes. That just happens to be Blue Cross's name that they call their
Okay.
supplement.
Yep.
But there's also Medicare Advantage plans, and those are HMOs and PPOs. We talk about the difference, what an HMO, Health Maintenance Organization,
Yeah.
stands for, and what you have to watch out for in the HMOs, because you need to make sure your doctor accepts that HMO, and then you need referrals to go see specialists. So we go over all the differences.
So is that a resource that you have as a counselor, the doctors
Yes.
and what they accept?
No, we don't have.
So it's up to the individual to find out.
Right, because it's constantly changing.
Yeah.
We just could never do that.
Okay.
But we do have charts for everything. You know, we have charts for what's available and the costs. We help them with the Part D drug plans.
Okay.
Medicare has a great plan finder on their Medicare.gov website. So we type in the person's medications, and it will tell us there's 30 plans, drug plans to choose from in Massachusetts. So it will tell us which is the best plan based on that person's medications.
Yeah.
So pretty much we go over the gamut for someone new to Medicare.
All right. So just, I don't know if we can do it briefly, but to remind people the difference between A, B, and C? Or?
Okay. Medicare Part A is your hospital coverage, and that is free if you've worked your 10 years or put in, you know, your 40 quarters. Part B is your medical. That's everything other than the hospital, so doctors, tests, ambulance, durable medical. That you have to pay for. And the base premium on that is $104.90
a month.
A month. It can be higher because it goes up on a sliding scale, but it's pretty high income. If your income is single person over $85,000, it can start to go up. If you're married and it's I think it's $170,000, it can go up. But that base Part B premium is $104.90. Yeah.
And that covers. So then there's no copay after that. That covers the doctor visits.
No, that's what I was talking about before. The supplements or the Medigaps.
Yes.
Just with A and B, you still have a hospital deductible, a Part B deductible, 20% of your doctor's visits. So that's where some people might pick up a supplement to fill those gaps. Don't have to, but you know, it just helps with the cost.
Yeah.
And then of course there's Part D, you know, the drug coverage.
Oh, what was C?
C is the Medicare Advantage plans, the HMOs and the PPOs. And then there's so many other things. We screen them for different programs that they might be eligible for. There's extra help for the Part B premium. The state will help pay that $104.90 if their income and assets are within a certain limit.
Right.
There's extra help with the Part D drug programs, also based on income and assets.
Oh, yeah.
There's Mass Health. So we screen them. There's Prescription Advantage. That's the state's drug program that helps people with their Part D. So it's very overwhelming and can be very confusing. It is.
Yeah.
It is.
So the initial experience then for someone coming in and speaking with you, you'd ask them a litany of questions about their health and their medications to try to define what the best program would be for them. Does that sound right?
Right. But we can't tell them which one they should go with. We just tell them these are your options.
Don't you have people grovel and say, please just tell me which one?
They all do.
Please just tell me which one to pick. That would be me.
They all do, and it's so hard.
Because you know it so well, and it's also new to other people. Yeah.
And I understand they might come back again, and that's fine, because that first meeting can be overwhelming, because we are giving them a lot of information.
Yeah. So what is that? You spend an hour with them when they set up those times?
For someone turning 65, it's about an hour's meeting.
Okay.
Yes. Yeah. Yeah. And then if there's additional help that they qualify for, that probably would be another appointment. We could help them fill out the Mass Health application or the Prescription Advantage application.
Yeah.
So that's a good idea of a lot of the clients we see. New to Medicare, going to be turning 65 soon.
Yep.
But then we see people like a daughter coming, she's taking care of her mother, you know, she's stressed out, she needs help in the home. So there we would try to see if the mother qualified for Mass Health. There's a great program called the Frail Elder Waiver, and it allows the person to have a much higher income, but they also have to be clinically assessed through Elder Services. So there's two parts to it.
Yeah.
But if you're eligible clinically and money and asset-wise, and you're on Mass Health, there's so many benefits. Your drug costs would be zero copays.
Oh, yeah.
You get help in the home. You know, the daughter can get paid. There's a program called the Adult Foster Care Program.
Oh, yeah.
So there's a lot of programs out there to help.
Is that Caregiver Home? Is that the
Caregiver
same?
Homes is one of the providers.
foster, yeah.
Adult foster care program.
Yeah, we've had them on the show, and that was a great program
Yeah,
too.
I used to work
yeah.
for them.
Oh, you did?
Yeah. And then
She
there's
knows it all.
and there's the personal care attendant program
Oh,
where
yeah.
you hire someone for so many hours per day. So there's a lot of programs out there, and we can refer them to different agencies such as Caregiver Homes or Elder Services to help with those, with the
Right.
different issues that the daughter is
Yeah.
dealing with.
So you really are the go-to resource for all
Yeah.
things available
Yes.
when people hit
yeah,
that point.
Really,
Yeah.
we really are, and it's can be very confusing. It's almost detective work when they come in. You think it's an easy one, and then all of a sudden they start.
Oh, did I tell you about that?
Yes,
Did I tell
exactly,
you about that?
exactly.
Yeah.
And it's like,
that
oh, wait
changes
a
it.
minute,
Oh, yeah.
But it's fun.
Is the, I know the Medicare Part D donut hole was a big discussion for a long time. Is that still kind of an issue out there? Or?
It's kind of dwindling. I don't know if you know the Affordable Care Act
Yes.
that came out in 2010. That is getting rid of the donut hole. By 2020, it's going to be gone. So each year, it's closing a little more, so the person doesn't have to pay as much in that donut hole.
Okay.
They used to have to pay 100% when they were in that donut hole. This year, I think it's 47.5% for brand names. So it is going to be gone by
Okay.
2020. Yeah.
Okay.
Yeah.
So the Affordable Care Act, now that we're on that topic, how has that changed what you do?
Thank God we're not involved with this new insurance. So if someone's on Medicare, they don't need to worry about signing up for that new insurance.
Oh, that's good to
They
know.
have health insurance. So
Okay.
that's one good thing. We don't have to get involved with that. But the Affordable Care Act has added some preventive benefits to Medicare. They've added an annual wellness checkup.
Oh, that's smart.
And they've lowered the cost for people for preventive. A lot of the preventive items now, you don't have to pay anything, where before you had to pay 20%.
Okay.
So the Affordable Care Act has added benefits actually to Medicare. So
That's nice.
yeah,
Yeah.
yeah.
Is that something that Medicare beneficiaries are alerted of automatically, or they would have to question it? I mean, are they getting a letter that says, "Hey, things have improved"?
Well,
knows?
I don't think so.
Yeah.
I mean, we have a preventive sheet that we give them when they come see us, and we tell them these are all your benefits that you can have.
Okay.
Use them.
Yeah.
They're there.
They're
use
there
them.
for you. Yeah.
Exactly.
Yeah.
And Medicare sends out a Medicare New handbook every year, each fall, with the new,
Okay.
the new things that are
Okay.
covered. But
Do you get involved in Medicare fraud issues?
not a real lot, but if we do have someone that comes to us, we kind of make sure it's not just like a coding error or, a mistyped social security number.
Right.
So we would start out maybe calling the doctor's office.
Double check.
Double checking. But if it's definitely looks like fraud, we would have them call the Medicare. There's a Medicare fraud hotline. And actually Medicare has found a lot of fraud across the states and has
Yeah.
recouped a lot of money, millions.
Right.
So they're doing really good on that end.
That's good.
Yeah, so I think the beneficiaries,
Unfortunately, that's a need,
are
yeah.
more aware now to look at their explanation of benefits,
Yes.
make sure they check to make sure they saw that doctor or
Yeah.
that.
That is good, because I know we have clients that will say, I know this is great, I don't even get a bill. So they see the sheet, they don't really review it because there's no
Exactly.
cost involved for
Right,
them.
right,
Yeah.
right.
Now, you have presentations coming up. You talked about at the beginning of the show. I don't know if because I think this will actually broadcast in time for
The April
that
15th?
event.
Okay, yeah, I'm having a baby boomer. Welcome to Medicare Baby Boomer Birthday Party at the Mashpee Senior Center on
Okay.
April 15th. It's at 2:30. So if someone's interested, call the Mashpee Senior Center
Okay.
and make a reservation.
Is it a freebie?
It's a freebie, and
All
Social
right.
Security will be there also
Okay.
presenting, so you get 2 people.
Yeah, great.
And then I'm also doing a Health Benefits University. May 14th, Caregiver Homes in Bayarda are sponsoring it. So a social worker can get 3 CEUs free.
Great.
So you'll get a Medicare 101, Mass Health updates.
Yep.
That's going to be held May 14th. So, and I'm always, people can call and ask me to come out and present anywhere. I'll come out and do a presentation at housing, senior centers, you name it,
Excellent.
I'll come out.
Very good. Well, Sheila, I appreciate it. We're out of time, and I know it goes fast,
Quick.
doesn't it?
Yes.
Good information. I appreciate your time. It was really
You're
good.
welcome.
Thanks so much.
Thank you for having me.
Okay, and I'm Jeanne Sarnosky wishing you good health and good health care.